A Detroit police cruiser drives through a crowd of protesters. Now Chief Craig is addressing the controversial incident and bringing another perspective into the conversation, that of the officers.
They believed they could be shot at, were being fired upon. And because of that, they had to take quick, evasive action.
A closer look at what the chief is saying prompted the incident. A dire warning regarding the coronavirus.
The window is closing for us to take action and get this under control.
31 states now reporting an increase in new cases, and we're seeing an uptick here in Michigan.
Pediatricians have a serious concern about your children during this pandemic.
We are the first public place they've been in 4 to 8 to 12 weeks now, and so they're just afraid to kind of enter the world.
Experts say there's something you should be aware of. We'll talk about it coming up.
It's like a restaurant with one thing on the menu, and we'll tell you how long we'll be serving it right now, first at 4.
Local 4 News starts now with a breaking news alert.
That breaking news from Pontiac, where one man is dead after a hit-and-run accident. We've got new video from the scene just this afternoon. Happened in the area of Woodward and Auburn near the Phoenix Center. Sheriff's deputies said the man was hit and the driver just kept on going. We'll continue to follow that investigation. Again, it's just getting underway. Also making headlines, first at 4, the video's everywhere. A Detroit police SUV driving through a crowd of protesters, knocking several people to the ground. And now the police chief, James Craig, is speaking out about what happened. Kimberly Gill in the newsroom with more. Kim, he says he's offering another perspective.
He is, Devin. Good afternoon to you. During a press briefing not too long ago, the chief focused on what the officers say happened during the incident. This is the video you were talking about from that violent confrontation. The incident was sparked last night in southwest Detroit. The chief says the protest started peacefully. Those who gathered were marching for both immigrant rights and to end police brutality. But things took a downward turn about 9:30. That's when marchers, who police called agitators, surrounded this SUV. It made its way through them there. And here's what the chief says happened next.
There's this loud crash or bang to the rear of the police car. And again, in their mind, as according to our investigation, they believed they could be shot at. They were being fired upon. And because of that, they had to take quick, evasive action. And when you talk about training, if you run into an ambush situation, the proper course is to get out for your safety.
And now the chief says he knows of no injuries from this incident. Meanwhile, the nonprofit organization By Any Means Necessary is calling for Chief Craig and Detroit Mayor Mike Duggan to resign. The organization plans to march to the 4th precinct. That's the precinct where the officer was driving that SUV works. Devin, we'll have a lot more coming up on the news at 5. Until then, we'll send it back to you.
You got it. All right, KG. Detroit police explain what went wrong in an arrest, meanwhile, made using facial recognition technology. Detroit police arrested Robert Williams of Farmington Hills back in January after falsely identifying him as a shoplifter using facial recognition technology. He never committed a crime. Now the ACLU has filed a complaint against DPD over the arrest. Here again, we had to turn to Chief Craig. He says the arrest should have been prevented.
The one thing that I've learned as we begin to look into this is clearly there was no managerial oversight relative to any of the detectives' work.
The department has now opened an internal investigation for neglect. Chief Craig says the department's new facial recognition policy calls for it to only be used in cases of violent crime. The U.S. Supreme Court handed down opinions today on some hot issues on abortion. The court struck down a Louisiana law requiring doctors at abortion clinics to have admitting privileges at nearby hospitals. Chief Justice John Roberts proving to be the swing vote, siding with the liberal quarter of the court, although he had ruled in support of a similar law in Texas back in 2016. But that law was struck down. It appears the Chief Justice respected that decision in his ruling today, siding with precedent. The court also refused to block the executions of 4 federal prison inmates in July and August, marking the first uses of the death penalty in federal cases that we've seen since 2003. Those will remain on the calendar. And the Supreme Court refused to hear an appeal by environmentalists to stop the construction of 145 miles of border wall between the U.S. and Mexico in Arizona, California, New Mexico, and Texas. A lawsuit by General Motors against Fiat Chrysler Automobiles with racketeering took A couple of quick turns today. GM says FCA's corrupt negotiations with the UAW were aimed at forcing a merger between the two automakers. Federal judge Paul Borman ordered CEOs Mary Barra and Mike Manley to meet in person and resolve this suit, saying the case is a waste of time, and wanted to hear from both CEOs on Wednesday. Well, today, GM got an appeals court to delay that meeting to consider legal points that GM has raised. So, interesting turn of events in the past 24 hours. We'll keep you posted on where it goes from here. Now let's move to coronavirus news. A summer tradition now among the many things canceled because of the pandemic. Organizers hit the brakes on the Woodward Dream Cruise this year. An estimated 1.5 million people usually come out to see all those cars and cruise Woodward every year. Birmingham city manager says the timing just isn't going to work this year. We do continue to monitor closely the coronavirus case count here at home, and the new numbers of new cases have been on the uprise. Again, this afternoon there are now 4 more confirmed deaths from COVID-19. In total, we've now lost more than 5,900 Michiganders to the virus. Michigan has more than 63,000 confirmed cases. That's up another 236 over the last 24 hours. As of Saturday afternoon, the official recovery total was 51,099 statewide. Now let's zoom out to the national front. Coronavirus cases spiking in many places across the country. That continues today. In total, more than 125,000 Americans have died from COVID-19. There are more than 2.5 million confirmed cases in the U.S., that according to the database that's being kept by researchers at Johns Hopkins University.
A dire warning from one Trump cabinet member.
The window is closing for us to take action and get this under control.
As 31 states report an increase in new coronavirus cases over the last week, like here in Florida, the state reporting more than 8,500 new cases Sunday, after reporting a record high Saturday of 9,000 cases. Florida Governor Ron DeSantis blaming recent increases on a, quote, test dump, a backlog of tests that all came through at the same time. A former CDC director discounted testing as the source of most increases.
I can tell you with 100% certainty that in most states where you're seeing an increase, it is a real increase. It is not more tests, it is more spread of the virus.
DeSantis concedes there is reason for concern, particularly in the demographics of the uptick of confirmed cases.
That positivity increase is really being driven by a big increase over the last 3 weeks in individuals testing positive throughout the state of Florida in younger age groups, particularly 18 to 44.
The numbers forcing DeSantis to hit pause on the state's reopening plan, closing bars across the state. And even with no state order, Miami-Dade, Broward, and Palm Beach counties planning to have all beaches closed for the July 4th holiday weekend.
It is an unfortunate result, but public health remains the focus of the elected leaders of Palm Beach County. And, unfortunately, this 4th of July will not be spent at the beach.
In Texas, cases are still surging, with the positivity rate increasing to more than 13% in recent days, according to Johns Hopkins University. Vice President Mike Pence now urging people to wear face masks after weeks of saying concerns over the sudden surge were overblown.
Wear a mask wherever it's indicated, or wherever you're not able to practice the kind of social distancing that would prevent the spread of the coronavirus.
Republican Senator Lamar Alexander stressing the importance of masks too, arguing President Trump could be the key to convincing more people to wear them.
I wish the president would wear a mask when it's appropriate, because millions of Americans admire him and they would follow his lead.
By the way, Vice President Pence is traveling to some of the states that are seeing these surges in cases, but the visits are changing. He's going to visit 2 more hard-hit states in the coming days, Arizona and Florida, but the events that were to be public events with him there have been canceled in both states out of concerns over the virus spread. Infectious disease expert Dr. Anthony Fauci, meanwhile, is warning that when the U.S. does have a COVID-19 vaccine, we still may not have full herd immunity.
I doubt seriously that any vaccine will ever be 100% protected. The best we've ever done is measles, which is 97 to 98% effective. That would be wonderful if we get there. I don't think we will. I would settle for a 70, 75% effective vaccine, because that would bring you to that level of would be herd immunity level.
If only
say 75% of Americans are willing to get the vaccine, and it's only, say, I think you just said 75% effective, is that going to get us to herd immunity?
Unlikely, and that's one of the reasons why we have to make sure we engage the community.
Yeah, herd immunity, of course, comes when a sufficient proportion of the population is immune to an infectious disease. If not enough people are vaccinated, we really can't reach herd immunity when a vaccine becomes available. But we do now know how much a drug that has been shown to benefit severely ill COVID-19 patients is going to cost. Gilead Sciences says it will charge more than $2,300 for a typical treatment course of remdesivir. That's for people covered by government programs. It'll cost more than $3,100 for people who have private medical insurance. With the pandemic, many parents avoided taking their children to the doctor over these last couple of months, but pediatricians have concerns about what will happen if those appointments are not rescheduled. Sandra Ali has a look in tonight's Kids at Home report.
Many parents are really worried these days about taking their children anywhere, especially to a doctor's office. But that fear, experts say, is having a ripple effect.
We saw an extremely steep decline in our patient volumes very, very shortly after this whole pandemic came to be.
Dr. Catherine Schaefer says the number of office visits at her practice have been cut by more than half.
I believe the date was March 17th. Declined by nearly 60%, nearly overnight. And what we're hearing from our patients' parents is they're afraid. They're afraid to come in. They're afraid to expose their kids to COVID. They don't know what to expect.
The majority of children aren't going to the doctor right now because of concerns over COVID-19. A recent study by the American Academy of Pediatrics estimates children are missing anywhere from 70 to 80% of their scheduled pediatric appointments.
The wellness visit is not just about vaccinations. In the younger age groups, under the age of 2, that is the primary way in which we vaccinate them, but it's a unique opportunity for us to assess the whole child and their family.
Besides vaccines, experts warn the bigger issue is missing out on developmental milestones in younger children and detecting mental health problems for older children and teens.
They're no longer going to daycare, they're no longer going to preschool, they're not going to school, and so the other eyes that have been on these kiddos with regard to their development are also not able to keep track of how things are going. And so it really has this sort of domino effect, and it's concerning.
The overall message to parents: be cautious, but think carefully before missing those appointments.
It's a scary world out there, but there are people who are advocates for their children and for their children's health, and those are the pediatricians. We don't want to put any child at risk unnecessarily, but we have the unique charge with making sure that the youngest population in our country is safe and healthy and safe from preventable diseases.
And right now the CDC is warning we could see a real outbreak of preventable diseases, especially because the orders for vaccines for children dropped significantly starting in March. Back to you.